Welcome. Today we're diving into a common yet often misunderstood condition: abnormal uterine bleeding. This is bleeding from the uterus that is different in frequency, duration, or amount from normal menstrual bleeding. It's important to understand that abnormal uterine bleeding, or AUB, isn't a disease itself, but rather a symptom indicating an underlying issue. This video will cover everything you need to know about AUB, from its causes to its treatment and management. So, what causes abnormal uterine bleeding? The list is quite extensive. Causes can be structural, meaning there's a physical issue in the uterus, such as polyps, adenomyosis, fibroids, or malignancy and hyperplasia. These are often remembered by the acronym PLM. Then there are non-structural causes which involve problems with hormone regulation, blood clotting, or the uterine lining itself. These are often recalled with the mnemonic cone: coagulopathy, ovulatory dysfunction, endometrial causes, iatrogenic, and not yet classified. Ovulatory dysfunction, often linked to conditions like polycystic ovary syndrome, thyroid disorders, or stress, is a major contributor. Blood clotting disorders can also prevent normal control of bleeding. Certain medications or medical devices, also lead to AUB. Finally, some cases remain unclassified initially, requiring further investigation. Let's delve into the pathophysiology, or how AUB develops. In a normal menstrual cycle, hormones like estrogen and progesterone orchestrate the build-up and shedding of the uterine lining, the endometrium. When these hormones are out of balance, the endometrium can thicken excessively, leading to prolonged or heavy bleeding. Without regular ovulation, progesterone levels remain low, leaving the endometrium unstable and prone to unpredictable shedding. Structural abnormalities, such as fibroids, can distort the uterine cavity, increasing the surface area for bleeding and preventing the uterus from contracting effectively to stop the flow. Blood clotting disorders impair the body's ability to form clots, further contributing to heavy or prolonged bleeding. All of these disrupt the normal mechanisms that control uterine bleeding. Understanding the epidemiology, or how common AUB is, helps put things into perspective. AUB is extremely prevalent, affecting women of all ages, but it's most common during adolescence and perimenopause. In adolescence, it's often due to hormonal imbalances as the body establishes regular ovulation. During perimenopause, hormonal fluctuations as the body prepares for menopause are the primary cause. The exact prevalence is difficult to pinpoint, as many women don't seek medical attention for mild or occasional abnormal bleeding. However, AUB is a significant contributor to gynecological visits and can impact quality of life for many women. What are the signs and symptoms of abnormal uterine bleeding? The hallmark symptom is, of course, a change in your normal menstrual pattern. This might mean periods that are heavier than usual, lasting longer than 7 days. You might experience bleeding between periods, known as intermenstrual bleeding or spotting. Periods could be more frequent, occurring less than 21 days apart, or less frequent, with intervals longer than 35 days. Pay attention to any changes in your cycle and be sure to discuss them with your healthcare provider. It is also important to consider how heavy bleeding can lead to iron deficiency anemia, which in turn causes fatigue, weakness, and shortness of breath. Diagnosis of AUB typically involves a thorough medical history, including details about your menstrual cycle, past pregnancies, medications, and any family history of bleeding disorders or gynecological conditions. A physical exam, including a pelvic exam, is also performed. Blood tests may be ordered to check hormone levels, rule out pregnancy, assess thyroid function, and screen for bleeding disorders and anemia. Imaging studies, such as transvaginal ultrasound, can help visualize the uterus and ovaries to identify structural abnormalities like fibroids or polyps. In some cases, a hysteroscopy, where a small camera is inserted into the uterus, or an endometrial biopsy, where a small sample of the uterine lining is taken, may be needed to further evaluate the cause of the bleeding. Abnormal uterine bleeding is classified into subtypes based on the PLM system we discussed earlier. This helps guide treatment decisions. P stands for polyps, A for adenomyosis, where the uterine lining grows into the uterine muscle, L for leiomyoma, also known as fibroids, and M for malignancy and hyperplasia, or cancerous and precancerous conditions. C represents coagulopathy or bleeding disorders, O is for ovulatory dysfunction, E for endometrial causes like infection, I for iatrogenic or medication-related causes, and N represents not yet classified. Classifying the AUB under these categories helps the healthcare provider address the underlying problem more effectively. Treatment and management of AUB depend on the underlying cause, the severity of the bleeding, and the woman's age, overall health, and reproductive goals. Options range from medical management to surgical intervention. Medical options include hormonal therapies, such as birth control pills, progestin-only pills or hormonal IUDs, which can help regulate the menstrual cycle and reduce bleeding. Nonsteroidal anti-inflammatory drugs, or NSAIDs, can help reduce pain and bleeding during periods. In severe cases of acute bleeding, intravenous estrogen or a blood transfusion might be necessary. Surgical options include dilation and curettage, or DNC, endometrial ablation, which destroys the lining of the uterus, myomectomy, which removes fibroids, and hysterectomy, which is the surgical removal of the uterus. The best approach is always tailored to the individual patient after a careful assessment. While it's not always possible to prevent AUB, there are steps you can take to reduce your risk. Maintaining a healthy weight, managing stress, and addressing underlying hormonal imbalances can help regulate your menstrual cycle. If you have a family history of bleeding disorders, discuss this with your healthcare provider. Regular check-ups with your gynecologist can help detect and address any potential problems early on. Early detection and management of conditions like PCOS or thyroid disorders can also help prevent ovulatory dysfunction and its associated bleeding issues. The prognosis for women with AUB is generally good, especially with appropriate diagnosis and management. While AUB can be disruptive and impact quality of life, most women find relief with treatment. Recent research focuses on developing more targeted therapies for specific causes of AUB, such as selective progesterone receptor modulators for fibroid management and improved diagnostic techniques for endometrial abnormalities. Continuous advancements are aimed at providing less invasive and more effective options for women suffering from AUB. Don't hesitate to talk to your doctor if you have any concerns. This video provides general information and doesn't constitute medical advice. Thank you for watching.